to. John's in Birmingham. John, what would you like to say?
Hi, I'm a GP. I work in a part of a large PCN, so a primary care network in Birmingham.
Okay.
And I look after the PAs that work for our PCN. We're a group of about 10 different practices. There's a lot of points I want to make. I'm going to try and sort of break it down.
Sure.
So it'll make some sort of sense. So, yes, people say that PAs have been around for a long time, but they haven't been around in general practice for a long time.
Right.
Now, the nature of our work in general practice is I don't know what's coming through the door. Patients come in. It could be anything from sniffle to a DVT to whatever.
Yes. That's the nature of the GP's practice, isn't it?
That is.
Yes.
Is. Hopefully we can weed out the severe chest pains and redirect them to hospital before they kind of get worse. So what we see is undifferentiated patients, and you need a lot of skill and experience to kind of be able to be safe in approaching that. Now, as the last caller mentioned, PAs come out of university after a 3-year degree, and because of the last government's push for PCNs, where they took a load of money from the GP contracts, they said in order to earn it back, you've got to work collaboratively in these PCN groups. And a portion of that money, for you to get it back, you could only spend it on certain people, such as PAs.
Oh, okay. So there was a financial imperative to the proliferation of physician associates.
There was. So money was.
It doesn't necessarily make it a bad thing, but it certainly illuminates the issue for me. Yeah.
But I'm getting there. So for an average practice, they were losing the equivalent of maybe 1.5 full-time equivalent salary GPs worth of income to put in this PCN to work together. Now, I'm not against working together. We do our COVID jabs together, we do our flu jabs together, and a lot of the working together has been good. But where we have been told that you have to hire a PA who earns out of university around 50 grand a year, if zero, okay, and you consider your average so-called junior doctor will earn 30-ish,
yes,
okay, when they start, that automatically you're not gonna, and then what are they gonna do? That's the next question. So they turn up, but you've got PA, what can they do? Well, you get them in general practice to see undifferentiated patients without any experience, which means the supervising doctor who holds legal responsibility when things go wrong, it falls on us,
yes,
as the supervising doctor. So a lot of them now, after all these cases that have happened, they're saying, okay, we need to be a little bit better with our supervision, which means I have to see every patient, which means I have to talk to you about every patient at the same time as me seeing my own patients.
So it's made your job harder?
It's made my job a lot harder. They will send some patients home, so I try not to let them see disease. I try not to let them see mental health, because you need a lot of skill with all of that. About 3 or 4 weeks ago...
Forgive, this is a silly question. Well, it's not a silly question, but they could develop that skill. I mean, the conversation has got two strands, hasn't it? There's a conversation about the shortness of the journey to patient consultations, but if they have been in the job for a long time, albeit that we might not be comfortable with the brevity of the training period, if they've been in the job for a long time, they will have developed some of the skills that you're worried about them not having.
I don't dispute, but what you have to understand is that at the point in time where we're saying that the NHS is strapped for cash, you're having to employ someone who will take 2 or 3 times as long, so they get 25 or 20, 30-minute appointments to see a patient. So when you look at that 50 grand that I'm paying them for 30-minute appointments, even if you push them down to 20 minutes, if I had that same money and I was able to employ whoever I chose, i.e. I would always choose a GP over a PA, 1, because they're responsible for themselves, I don't have to supervise them, 2, they can prescribe, 3, having been through medical school, junior doctor training, and got the CT in general practice, they're then able to work independently, and I expect a basic level of...
I get it. Okay, I'm going to run out of time. So, in your words, why have they done this then?
They've done this because there was a concern about capacity in the NHS. There's concerns about doctors.
So they
leaving.
thought that this would make it easier to get a GP appointment. Well, they thought this would make it to get an appointment in the building where the GPs are.
Correct, and it's wrong. I'm dead against it.
You are, aren't you?
And I've seen the harm it's done. I once tried to send a patient home who clearly had appendicitis, and came talk to me about the patient, and I said, no, I must see the patient.
Right.
Grabbed the back, I examined it. It was pretty obvious. I said, well, and this was someone that's been with us for pretty much 18 months as a PA working amongst different practices. So they're getting a variety
So
of
you had
experience.
no choice financially but to do it, but you recognised that it was introduced in order to increase capacity in what we still call a GP surgery by massively increasing the likelihood of us not being seen by a GP, which means the more conscientious a GP you are, the worse your working life has become, because you're now operating as both treatment supplier and supervisor.
Before we finish, one of the consequences of this has been because our funding has been taken, we've been told you can only spend it on certain things.
Yes.
That's why you have so many GPs now out of work. Now, who would have thought that 5, 6, 7 years ago?
Oh, there's the final piece of the jigsaw. And people may not be aware of this, but the number of actual qualified GPs who can't find work. I suppose we need to leave a couple of gaps in the jigsaw, don't we, John? So why would you not hire them instead? Oh, because you're not allowed to pay them, even though you'd be paying them less under the... Oh, what a tangled web they weave. Thomas Watts has your headlines.